good relationship. No, I didn't like when they...
The northern Italian city of Bergamo. Crematorium so...
4 hours on Monday, China reported 78 new cases of...
Untuk memaklumkan status terkini wabak COVID-19 di negara kita.
The pandemic that we are facing right now is unlike any other. This virus, named by the WHO as COVID-19, has created a healthcare crisis unseen in generations. This outbreak began in China, and when traced, it is likely originated from wet markets, specifically from bats. The precise wet market in question is a market in Wuhan. However, early studies by scientists has been refuted, and it remains unclear if it even started with a bat. But that's a topic for another day. We are here to talk about COVID-19 cases in Malaysia, specifically in Johor, a state where all of the current cases began. Globally, the cumulative cases as of 3rd December are at 64,812,136 with 1.5 million deaths. And in Malaysia, the numbers are still rising with 68,020 infected and 365 deaths. Talk about one death per day for a year. In this video, we'll be explaining about the epidemiologic approach, defining the case, and how this disease is modified.
I am going to talk a bit about the history of COVID-19 in Johor, Malaysia. So back then, in the early of this year, the first case of COVID-19 reported in Malaysia was in Johor, when 3 tourists from China were tested positive for the virus. They entered Malaysia through a checkpoint in Singapore on 25 January 2020. The day before, 8 tourists from China were believed to have a contact with an infected person in Singapore before entering Malaysia. Then they were quarantined in a hotel of Iskandar Puteri in Johor and were tested negative on that day. However, 3 of them were tested positive on the next day. Besides that, a new case was reported on the same day, where the patient was also from Wuhan, China. He developed a fever 2 days before entering Malaysia. Then he was diagnosed after went to a private hospital for an examination. Then all of these patients were referred to Sungai Buloh Hospital in Selangor to get the treatment and to be monitored. Cases in Johor increased, where the total of new cases in Malaysia on that time was 7 cases, when there were 2 new cases were reported involving a Chinese couple. However, the cases did not stop there. In the early of February, a new case was reported, where the patient was a female, a Chinese female. She developed a fever in the late January and was diagnosed on the earlier of February. The cases in Johor kept increasing in the earlier of March. According to the table, the number of cases rose to 349 in March and 293 in April, and the total deaths for both months was 18. This is when the second wave of COVID-19 began in Malaysia, and because of the sudden spike number of cases, an announcement has been made by the Prime Minister of Malaysia, in which Movement Control Order MCO will be declared for 2 weeks starting from 18 March 2020 in order to curb the spread of this highly contagious virus. On May 2020, the number of cases in Johor decreased to single digit, which is 9 and 1 death reported, allowing them to exit the red zone. Johor stayed stable with 14 cases and 1 death reported in June, but the cases start to spike again when 25 cases and 1 death reported in July, which was the majority of new cases in Malaysia on that time. As the month goes by, 11 cases were reported in August, but the situation became worse when there was a rapid increase in the number of cases from September to November 2020. However, there was no fatal cases reported from August to October. Meanwhile, in November, there was one fatal cases, taking the total deaths in Malaysia from March 2020 to November 2020 to 22 deaths.
Bismillahirrahmanirrahim. Next will be the epidemiology approach. By the 1st of December 2020, there were currently 369 active cases from a total of 1,447 people infected in Johor. Johor Bahru, Batu Pahat, Kluang, Kota Tinggi, Kulai and Muar are now in red zone, zone with greater or equal to 41 cases. Tangka, Segamat and Pontian were in orange zone, zoned with 21 to 40 cases, while Mersing is in yellow zone, zone with 1 to 20 cases. Within November 1, 2020 until December 1, 2020, the highest reported cases in Johor was on 1st of December with 68 cases, involving 41 cases were from the existing cluster, 18 cases were from screening of close contact of confirmed cases, and another 9 cases were from other COVID-19 screenings. Followed by 60 cases on 26th of November, which involved 54 cases were from existing clusters, including 23 cases were from the new cluster, which is cluster Gemilang. 2 cases were from the screenings of close contact of confirmed cases, and another 4 cases were from other COVID-19 screenings. The lowest cases reported were on 1st of November and 8th of November with 1 case respectively, whereby the case reported on 8th November was from the screening from high-risk area in Sabah. This data was taken from Kenyataan Akhbar KPK November 2020, situasi semasa jangkitan penyakit coronavirus 2019 COVID-19 di Malaysia on 2nd of December 2020. According to the statistic, an average of 18.06 cases per 1 million population were reported in Johor. Based on the Johor 2020, the population in Johor is currently 3.76 million, so it would be an average of 4.59 cases per 3.76 million for people that is less than 16 years old, compared to 1.49 cases of people that is more than 60 years old in Johor.
SARS-CoV-2 is the causative agent for COVID-19 that can produce a range of clinical manifestations. Some people who are infected can develop some symptoms, but there are also some people who are infected never develop any symptoms, also known as asymptomatic patients. When people do get sick from the coronavirus, it takes on average of 5 days and as many as 2 weeks to develop symptoms that can range from very mild to extremely dangerous. According to the WHO, the individual must develop fever and cough or acute onset of any of these 3 signs and symptoms such as fatigue, headache, sore throat, coryza, and diarrhea. The clinical criteria include the confirmatory test to diagnose whether they have been infected. Reverse transcriptase polymerase chain reaction (RT-PCR) is widely used as the reference standard for diagnosis of COVID-19. However, limitations include potential negative results, availability test materials, and changes in diagnostic accuracy. This method involves reverse transcription of genetic material of RNA viruses to complementary DNA. followed by amplification of some regions of complementary DNA. PCR test is not useful in distinguishing between the highly infective viruses versus one that have neutralized by the host, and it cannot access the immunity status against SARS-CoV-2. Thus, serological test is used as it is blood-based test that provides more accuracy in estimation of SARS-CoV-2 by potentially detecting individuals with immunity against the disease, as these tests detect markers of the immune response. Other than that, support tests can diagnose the COVID-19 case. However, they still show alteration characteristic of COVID-19. The results of imaging tests are not specific to COVID-19, as the alterations described can be found in influenza or mycoplasma infection. However, it may be helped in diagnosis with the presence of possible contact history. Patients of COVID-19 cases can be classified into 3 types depending on what evidence symptoms are present. Suspected case, where the person who meets the clinical criteria such as fever, cough, shortness of breathing, and fatigue. Probable case is where the person with rapid test kit antigen positive and awaiting for RT-PCR result, or a suspect case with chest imaging showing findings of COVID-19 disease. A person with the laboratory confirmation of infection was classified to confirmed case of COVID-19 regardless of any symptoms.
Let's see how this disease is modified. Patients in the first case definition had to have an epidemiological correlation with Huanan Seafood Market in Wuhan. Detection of patient as the suspected cases must satisfy the 4 clinical criteria of viral pneumonia such as fever, cough, breathing shortage and fatigue, and must undergo all clinical manifestations. Confirmation as the patient of COVID-19 must undergo full genome sequencing from the respiratory specimen to be tested that gives results similar to SARS-CoV-2. For second modification of case definition, to identify the suspected case, the criteria of failure antibiotic treatment eliminated from clinical manifestations and PCR tests can be added to full genome sequencing. Next, the third modification remain the case definition. However, there are modification and clarification to classify the severe and critical cases. Fourth modification of the case is that the area of reported cases has been in wide range and the suspicious case need only 2 types of clinical manifestations rather than 3 before. Fifth addition in modifying case definition introduced a new category of cases specifically for Hubei area. Patients that have pneumonia and fulfill the clinical requirements did not have virological confirmation for the infection. Sixth addition of modifying case involved in eliminating the clinically diagnosed confirmed cases, and the case have no difference between the cases within Hubei or outside the area. The latest change in case definition was the serological test have been added for laboratory confirmation of COVID-19 cases. To wrap this all up, it is still unknown when or if this pandemic will be curbed anytime soon. In the meantime, always practice physical distancing, follow the SOPs, and take care of your loved ones. Let us all band up together in fighting this horrifying virus in hopes that we could get back to normal in the near future. We have yet to win this war.